Now we're talking about the minimal invasive techniques for Tailor's bunion or Bunionette. At the end of the day, the pathology is the prominence of the fifth metatarsal head, which is prominent plantar lateral. And the goal for this technique is to reduce the pressure here by shifting the head more to medial. I will show you the burr which I use for this. So we have a small bone, it's the fifth metatarsal head. The diameter fits for me very well for a 13 millimeter Shannon burr with a diameter of 2. Before I start, I mark my incision points in the X-ray. So this is a little bit more distal, proximal than I would like to have it. This is my position I would like to be to do my incision. The goal of the operation is shifting of the head from lateral to medial by performing a metatarsal osteotomy at that area. You can do this directly from lateral to do a transverse cut, or what I prefer is coming a little bit more from medial to get a little bit tilting by cutting more bone from the medial aspect and then add this to the shifting. So this is my entry point. I go directly inside the bone. Just try to be only on the medial part. And as soon as I'm inside the bone, I stop. I take an X-ray and I see that I'm in the right position. And then I try to get a little bit more from the medial part of the metatarsal. So it's still, the lateral cortex is still intact, and the X-ray shows you this. So now I have the chance to weaken the lateral cortical to do the shifting and achieve an additional tilting. So I go in and just complete the osteotomy. Now I shift it. And I have my correction. I have a tilting and a shifting. So next step will be the fixation. You can achieve the fixation with I use a headless screw for this, 3.3 or less. It depends on the bone diameter. And this is a cannulated system, so I can bring in a key wire first to fix it in a position where I would like to have it. First X-ray to check this position. So you can achieve the correction with a small screw, fix it, and in dependence on the pathology, more tilting, less tilting, and more shifting or less shifting if you would like to have it.